Dr. Owenbrink with Appalachian Wellness, reviewing the concept of medication-assisted treatment of addiction. The medications make it a whole lot easier to get clean and sober, greatly improves survivability in this disease, and is just such a much easier way to go than total abstinence.
Medication-assisted treatment, MAT. Medications can make addiction treatment easier and more successful for the patient. Medically assisted treatment involves the use of medications to not only help with the detox phase of treatment, but also to help patients have an easier time getting into recovery. Medications and protocols are available for abuse and addiction of all the major drug classes: alcohol, amphetamines, benzodiazepines and barbiturates, cocaine, ecstasy, inhalants or huffing, marijuana, methamphetamine, nicotine, and opiates. The best success rate for medication-assisted therapy is with opiates. There is no such thing as a medication to cure addiction. Cure means a one-time treatment producing permanent results, such as with a strep throat. Control means that if the treatment is used, the problem can be controlled. Diabetes, high blood pressure, and others can be controlled but not cured. Treatment to control generally requires periodic monitoring and possible adjustments of dosage, medication, and other factors. Various medications are used to treat addiction to specific substances. There is no one-size-fits-all. Treatment is tailored to an individual patient's need. Diagnosis or comorbid conditions also need attention for successful treatment. Most folks use drugs to feel better. Sometimes people are self-treating various forms of mental illness that may have never been diagnosed, much less properly treated. Numerous mental health issues must be addressed for proper addiction treatment. Anxiety, depression, bipolar disorder, also known as manic depression, post-traumatic stress disorder, various sorts of psychological trauma, and traumatic brain injury can often be undiagnosed, and addiction will persist until these things are successfully treated, thus making it much easier for the patient to enter into the process of recovery, the adventure of recovery. Many of these can be successfully treated and managed by an addiction-trained physician. Sometimes other help is needed, including psychology, psychiatry, clergy, and family therapy. Although addiction can mimic every form of mental and emotional disease, treating the chemical imbalances caused by these conditions is crucial to attaining meaningful recovery for the patient. Ignoring these comorbid dual diagnostic conditions does a great disservice to the patient.